Our three speakers today are Joan Sage, who is a pediatrician of nearly 30 years and past president of Oregon Right to Life. Then we have Joan Bedline, who's a registered nurse and a parent of a daughter born with spina bifida. And we have Cindy Miller, who's also a mom of a special needs child who has developed literacy programs for children with developmental disabilities.
Thanks, Mike. Good morning. Thank you for coming in. Just a couple definitions first. We know prenatal means before birth. Adverse means having a result that you didn't expect or didn't want. And fetus, when we use the word fetal or fetus, it's not dehumanizing the child. It's just the medical, it's the Latin term for it is, it's the Latin term for offspring. And so when we use it medically, we're talking about the baby in the womb from 8 weeks, when all the organs are in place, until birth. So using the word fetal and so forth, I just wanted to make sure people understand that. Okay, so what if parenting dreams are dashed? Randy Alcorn tells a story in the updated version of his book, Why Pro-Life? Caring for the unborn and their mothers. He tells a story about an expectant couple who was in his Sunday school class that he was teaching. They had heard that their baby was anencephalic. They were so devastated, of course, about that, and asked for prayer in the Sunday school class. Randy, being an avid pro-lifer, was aware that abortion would probably be one of the options that they would be encouraged to. He waited to kind of see what the other Sunday school attendees would do, how they would respond. Would they alert this family about the possibility of abortion and try to discourage them from that or not? Several of the people were sympathetic and went up to the couple and just spoke nicely to them, but nobody brought up the possibility of abortion or of not choosing that. When they were all left, he went up to them quietly and gently and just kind of talked with them a bit more. And he found out, they said that they were hopeless. And actually, they had really decided to end it then and there, pretty soon as possible, because of what the doctor had already advised them. If this was your Sunday school class, how would you have responded? If it was your friend or relative nowadays, what resources would you turn to help you work with that family? How would you respond? So our goal today is to help equip and embolden people to advocate for life in these dire situations. I'm going to put my glasses on. We will go through looking at the prenatal testing. This will help us to understand the world that the expectant parents get to. We'll just take a glimpse into that. And we'll look at the responses and consequences, the responses being voices that they hear, the responses that will influence their decision, and then what some consequences of that decision might be. And then we'll look at some resources that you can use to embolden yourself, to educate yourself about these situations, as well as what you can direct the parents to look at, which will help to give them hope. And then we'll have a question and answer panel with myself and the two parents who are joining me with this workshop. Before we go on, though, I'd like to talk about who the prenatal testing is about, who is at the center of it. I'm going to show a film, a simulation of life in the womb. And I just wanted to say, if there's anyone here who that might be disturbing for you, you can just close your eyes during the film. I'll speak when it's done, and you can then open your eyes. If you or somebody you know might be struggling with an abortion, whether done for birth defects or not, you can call a confidential number, 503-22-HEART, H-E-A-R-T. And that will bring you some confidential help through First Image's post-abortion help program. You can also look at the exhibit that they have out there. Check out that booth for the First Image out there, Pregnancy Resource Center. So let's look at the film. Maybe I'll sit down. It's about a minute and a half. God's doing, huh? Did you catch that? Did you see when that baby became human? Life is continuous from conception on. So, development, though, doesn't always go as smoothly as it did in the film. Sometimes there are deviations along the way, and we call those birth defects. Birth defects, though, are not new. There are biblical references to them. The Old Testament, New Testament, you hear of babies being made dumb, blind, variety of birth defects. And we know that in John 9, the disciples asked Jesus, "Who sinned that this man was born blind?" And he said, "It's not his parents' sin. It was so that the works of God might be displayed in his life." I suspect many of you might believe, like I do, that everybody was conceived for God's glory. And I include in that the unborn who have genetic or structural abnormalities. And those are the babies that are the target, or that are prenatal testing is aimed at detecting. It's because of birth defects that we have prenatal testing. So let's go ahead now to the section we'll talk about, take a glimpse into the world of prenatal testing. Prenatal testing actually started out with good intentions. In about 1950s is when amniocentesis, which was the first tool, that's something that actually has existed since the 1800s, where they would tap the fluid off the mom's belly later in pregnancy. But in any case, in the 1950s is when that was used to help diagnose babies that might have Rh disease. It helped them discover Rh disease and then also be able to take care of that and help save some babies' lives. You might recognize that disease. You've heard of Rogam. Rogam is a medication that's given to some moms nowadays to help them, moms that are at risk, to help them not have that issue. And it's essentially eliminated that disease. In about the 1970s, ultrasound, which had been getting more and more used in medicine, started to be used, and that was also helpful in helping to make amniocentesis easier. I don't think I defined amniocentesis. That's where they put a needle through the mom's abdomen to get some of the fluid that's around the baby. And you saw in the film, the baby was swimming in fluid. You get that fluid, and you can do studies on the fluid and some cells. With genetic advances over these years, since the 50s, 60s, 70s, and on to now, the lab techniques have improved, genetic knowledge has gotten along, that the power to diagnose prenatally has just pretty much exploded. There are at least hundreds, some would say thousands, depending on which defects you count. There are hundreds of diseases that can be diagnosed: genetics, chromosomal, metabolic, just chemical disorders, as well as structural abnormalities. These are some of the conditions that you will hear about many of the times. They're not the only ones, but you can see chromosomal as well as the neurotube disorders are ones where the person is born with a hole that's in the spine or the head. There can be conditions of the kidney, the heart, other things, even syndromes that can cause learning or behavior problems. So you see, we have the power to diagnose some of these things while the baby's in the womb. Testing, prenatal testing, is not mandated. It is offered, but you don't have to do them. And I just want to make sure that we realize we're talking only about the tests that are looking for birth defects. There are tests that are going to be done to check for the health of the mother and the baby throughout the pregnancy. I'm not talking about those. We're talking about the ones that are particularly for diagnosing birth defects. They're offered to the moms generally around the 10 to 11 weeks in different segments of the pregnancy. The tests can be offered and are helpful. You can have tests on the mom's blood, ultrasound. Nucleotranslucency is something that's used for screening for Downs. This part of the pregnancy, there's just early screening for particularly the trisomies like Down syndrome or Edwards syndrome, trisomy 18, or for neurotube defects. In the second trimester, the baby is bigger, and so further testing can be done, and the ultrasound can reveal a bit more. Again, the organs were present from 8 weeks, but as they got bigger, now you can see a little bit more detail and know whether or not there are structural abnormalities. So, you get the results. So what? What then? You would think, ideally, that that knowledge would help the parents and the medical team to prepare for the child's birth, to maximize that, maybe so that they're born in the appropriate setting where they can get the help. Unfortunately, nowadays, as one of our speakers said, we're in a culture of death. And the bias is towards termination. Many times, the mom gets the diagnosis and termination is offered as a way to get rid of that baby with a problem. The bias towards termination is so strong, too, though, that in some news reports, one country was touted as having cured Down syndrome because nobody in that country is being born with that condition. Iceland, in particular, is the one that 100% of the babies that are diagnosed with Down syndrome prenatally are aborted. Occasionally, one slips through because sometimes the test may not have revealed it. Europe overall aborts 92% of their Down syndrome babies diagnosed prenatally. And in the US, the number is actually 67 to 90%, depending on the setting of people that you look at. However, prenatal tests, we know, so they can be used to help prepare a family and the medical team for a child that might have an issue. But as I just alluded to here, too often it leads to a high percentage of death for certain babies. Down syndrome is one, sometimes spina bifida, sometimes something as simple as not simple, but cystic fibrosis, apparently. Many people will diagnose for that nowadays, although that's a lot more curable than it used to be in years when I was trained. In any case, or treatable, I should say. But there are imperfections with the tests. There can be screening or diagnostic. Some of them, people get a result and they think, oh, that's the diagnosis. But it was just a screening test. Diagnostic tests are ones that will really more firmly give you the result. So one needs to know that it's not always a firm diagnosis. Unfortunately, some people will hear the suggestion of a problem and decide to abort and not necessarily wait for a fully diagnostic test. Sometimes you can't fully diagnose either. But some of the tests are invasive and some are not. Amniocentesis would be considered invasive because it can hurt the mom or the baby. Non-invasive tests might be the blood tests, the blood tests of the mom, or ultrasound. Essentially, ultrasound is not invasive. There are questions about if there might be some effects, but the way they're done today, they're felt to be fairly safe for the babies. There can be false positive. False positive results can say, oh, this baby has this condition, when really they don't. They didn't. A baby might be born. You were thinking that they had it, and then they got aborted, and the baby looked normal. Or false negative might be one that said, oh, everything's fine. But yeah, the child is born, and then they did really have the condition. So false negative says there wasn't a problem, but there was. I saved this personally because I wanted to, purposely because I wanted to point out the last thing, is that the prognosis that you get from the diagnosis is not the final word. It's not a definitive diagnosis. We can make an educated guess as to what the course of that disease might be with a child, but it's not the final word on what that child's life is going to be like. And I think you'll get a little bit more on that later. So prognosis is just a guess. Sometimes children do better than we doctors say that they will. And one mom got it. She said, tell the expectant parents, the diagnosis is not your baby. We get caught up. This is the diagnosis, and you're only seeing that, but you're not seeing the baby. I had one mom tell me that disability is scary until you get into it, until you meet that child. So the diagnosis isn't your baby. So let's look at some responses and consequences in getting the results. Expectant parents, when they're getting an adverse result, they don't think of imperfections with the test. You might hope it's not right, but they're not even there. They're just in shock that their baby may have a problem. They've gone from being excited that they have this child on the way to and are expecting a healthy baby to sudden shock and grief. Their parenting dreams are dashed. They are just plain scary. It's just a plain scary place to be. Their situation is more severe, but kind of akin to an experience I had a couple years ago. We were planning a trip to Arizona, and my husband said, oh, let's visit the Grand Canyon. I'm like, oh, the magnificent wonder I've only seen in pictures. Yes, let's go, let's do it. And I beamed with excitement, seeing this awesome place, evidence of Creator God. I never imagined there'd be any difficulty. We'd just be sightseeing. But then, like a storm coming in, fear took over when my husband said, let's do one of their mule rides. I would say dread, and I almost wanted to cancel the trip. But I'd never driven. I've never ridden on an animal. To be on the animal, at the mercy of the animal, on these narrow, rocky paths, at the edge of these steep precipices. Would I and the animal just go tumbling down this rocky abyss? That's how, it was scary. Of course, the expectant parents are not dealing with an optional trip. They're in the scariest spot ever. Also, just the emotional turmoil they're in, they're also thrust into a dilemma. Right as they hear this news, they're thrust into a dilemma because right along with the result, they're often offered the option of abortion. And they need to decide quickly so that they don't get too far in pregnancy before for abortion. It gets more risky the further they wait. So we as advocates need to realize that the parents' decision depends very heavily on the voices that they hear. And by the voices, I mean the responses that they're going to get. Initially, there might be the internal voice. The mom will have the internal voice that's, pro-life already. She may already have a faith in God's sovereignty, and this is just fine. She may also just a mother instinct that says, "This is my baby. I don't care. I want to just love this baby, and I want to take care of this baby." Occasionally, some moms here in the news will just immediately want to do an abortion because they are already, they misunderstand what's going on inside of them, and they're already deceived about life in the womb and what's really better for themselves or what's life-giving. The external voices that the expectant parents might hear might be from the medical team, will be from the medical team, that's where they hear it first, but also family and friends and society in general. The medical responses tend to be terminate and quickly. But there are some pro-life doctors, and these three organizations are ones that many of the doctors are associated with that represent pro-life doctors. The APLOG is American Association of Pro-Life OB-GYNs, obstetric gynecologists. CMD is Christian Medical Dental Association, that has a variety of specialists involved. And ACP, not the AAP. ACP, the American College of Pediatrics. All three of those organizations value life from conception on. Societal responses do tend to be mostly pro-abortion. Your family and friends, they might think that they're supporting the mom because they are also grieving with the potential hardships that she'd have and the potential hardships for the baby, and they think they're supporting her by saying, yes, go ahead with an abortion. They, just like others in society, just lack knowledge about the humans in the womb. Some are deceived about what's best for the child and the mother, and some just don't value children, especially children who the culture deem imperfect or inconvenient. Besides, the government says it's okay by the laws. There are pro-life voices in society, though, and we saw many of them. That's what we're here about. So look around and you'll see that. But some are unaware as to the plight of these parents with children with severe disorders. We know in general, yes, we say, let's save these babies. But there are some who would be avidly for not having abortion, who, when they hear of the situation, being a child with a severe problem, or one who might die in the womb anyway, they'll pause, and they're not so sure that abortion isn't the right way to go anyhow. So that even some pro-life people are tempted that way. Some feel ill-equipped for those situations. I know, it doesn't happen that often. It's about maybe 3% or so of babies that might have the really severe problems. But it happens. So I suspect that this might have been the position of many in the opening story. I don't know. But they probably might have been for life but didn't know how to help in this situation. There is also a time factor in trying to help the parent. In addition to the voices that may sway him, the couples, the window of opportunity to impact their decision is short. This time-critical factor is kind of came out in a study that was spearheaded by David Reardon. He's a expert, PhD expert in post-abortion women and the effects on them. And several years ago, 2 or 3 decades ago, I guess, he spearheaded a study of women exploited by abortion. This was a support group of women who felt that they had been exploited by abortion. And he wrote various survey questions, and they did the survey among the women. And it's a selected group, obviously. It's only ones who felt that they were exploited, and not random, where you just kind of just give it to everybody who's had an abortion. However, it was demographically varied, except for race. It was demographically varied in terms of socioeconomic status and education, etc. And it documents the reality of their experiences. And it's consistent with what many of us have experienced as we talk to a variety of people who have had abortions and what their experiences are. I suspect it might even be worse nowadays because of chemical abortions, that people can access those so much more quickly and before you have time to get to them, in a sense. The results came out. There were 252 women across 42 states who were surveyed. And the things that struck me, there are several things there, but the particular ones I wanted to point out right now are the 51% who decided in 1 to 4 days, 75% by a week. Also, then 76% plus who would have not have chosen abortion if encouraged differently. I suspect that number is lower. You've heard the 2 speakers earlier, and I know that even pregnancy resource centers started because somebody wrote to the Christian Action Council, who was trying to speak up for God principles, and they're saying, where were you when I was pregnant? Many people who've had an abortion wonder that. They would have loved to have been encouraged differently. They didn't know there was another choice. So this is why your advocacy matters. Just one voice could save a woman and the baby, save the woman the heartaches that you hear about, and save the baby's lives. Whatever the decision, though, there are consequences. Certainly for the baby, there's death, the loss of the opportunity to be loved and known, and to just live out their own life, however long that would be. Or, of course, there would be the life. Sure, they would have, they sometimes turn out to be normal, but they may have other problems. But as one mom has said, what child doesn't have problems, doesn't have issues? And it varies for people. But at least they would have life and have the opportunity to be loved, to be known, and so forth. The parents, if they choose abortion, would have grief. But it's a grief with guilt. It's a different kind of grief than just having lost your child that you did all you could for. Those that choose life would have an irreplaceable joy along with, there's a loss, and I'm not downplaying that, but there tends to be an irreplaceable joy of having met their child, of having whatever days and weeks or months, sometimes years, that they have, and the family gets impacted positively, the siblings and others in the community. Siblings can have quiet doubts. There's a counselor, Dr. Philip Ney. He's a Canadian psychologist who's also a child and family psychiatrist, who in his counseling discovered not only about women having post-abortion symptoms, but siblings of aborted babies who were also kind of having anxiety and depression and survivor's guilt. He coined the term, I believe he coined it, post-abortion survivor syndrome, because it's just like others who've been in a very traumatic event and then they have to deal with they survived it and the other didn't. Some kids will have doubts about their parents' love. They may not show it on the surface, but there's an insecurity that can come along. Versus if they do choose life, the siblings have that more confident trust in their parents and recognizing that just seeing their parents love the other child, and they themselves get to love the other child. And I remember a quote by one girl that wrote this on a website. It said, people say, wouldn't you like a normal brother? Her brother had Down syndrome. Wouldn't you like a normal brother? She said, but what is normal? I like Henry the way he is, and he's made me who I am, So the kids are very accepting. Even if the baby dies spontaneously in the womb or soon after, the parents and family will grieve, but again, overall, they have peace knowing that they did as much as they could and love their babies for all of his or her life. This was the outcome of the Alcorn story that I started earlier. Remember, Randy Alcorn is an aware pro-lifer. He's a very prolific pro-lifer. Anyhow, this family had the child with anencephaly. They were going to see the doctor the next day. They had, based on the doctor's advice before, actually thought they would just go ahead and end it as soon as possible. But when all the people left the Sunday school room, he gently approached them privately, and he helped them kind of sort through their values. He said, if one of your other children that you have right now, if you were told that they were going to die in a year, would you say, okay, just end it now? Or would you love them for the rest of their life? And going through that, they realized they kept their baby. And they chose life. And of course, there were challenges, because this baby was anencephalic, but the parents and the siblings were able to hold and love that child for the weeks that she did live outside the womb. Rather than guilt and shame, the parents and the siblings went on to have cherished memories of their daughter and sister. And overall, the parents fed back to him that the experience was healing. So we have we've peeked into the womb. We've done an overview of prenatal testing. There's so much more deeply we could go. But for our purposes, we've done that overview. We've explored the voices that impact decision and consequences. Now let's look at some resources that you can use to help. Oh, what is this here? Oh, I forgot to mention, this is just Rachel's Vineyard is one of the largest post-abortion healing ministries worldwide. And Kevin Burke is co-founded it. And he said one of their hardest cases that they have there are couples who aborted because of fetal disability. It's a very complicated grief that they can go through, knowing that they ended their child's life. Oh, I'm behind myself. Okay, so let's look at resources. These are things that will be able to help you know a little bit more about what the parents might be dealing with, and also how you can help in the dire situations. I see being aware of it as being a tool. You just being aware of what they might be going through, having the compassion to deal with that. What I would say too with the awareness is you are now aware, and you can help others to be aware. You don't know who will run into a family that might be dealing with this situation. So you can keep your ears open and help others to be aware of what may be going on. Compassion is when, Merriam-Webster says, is sympathetic consciousness of others' distress together with a desire to alleviate it. And I think that that speaks for itself here as we become aware and we want to help in the situation. Some crucial keys, though, in addition to prayer for the parents' courage, are informed decision-making and people. Those are the main two I'm going to spend a little bit more time on. I say there's an information deficit for the many choosing abortion. In this same study, we saw that 74% felt that their decision wasn't well thought out. 88% felt that they didn't have the necessary information. So it will help to encourage the couple to pause and do some informed decision-making. That means asking lots of questions, gathering the facts, assessing their priorities and their values, considering the options, the consequences of their options, deciding then with a clear conscience. They're going to be better able to do that if they pause and do that. A decision-making, an ethical decision-making tool that I liked to use when I was on an ethics committee and was one that's called the Jonsen method of ethical decision-making. He and some others developed it, and I learned it from him. And it's in the book Clinical Ethics by Jonsen et al. I tweaked it for our situation here, but basically you have 4 quadrants: medical facts, patient preference, quality of life, and contextual features. And generally, by the time you go through medical facts and patient preference, a lot of time that helps to clarify some very challenging ethical situations. Again, I tweaked it for our situation. If we look at the facts, when someone says they have a diagnosis, is a diagnosis really just a screening result or a diagnostic result? What is the specific diagnosis that you were told? How firm is that diagnosis? And what is known medically about that condition? You also want to know who is giving the prognosis. Have they dealt with or cared for children with that condition? How aware are they of how how that condition plays out in people's lives? Some of us were trained for something like trisomy 18. We're trained that trisomy 18, people don't live with that. Of course, people are living till into the teens and sometimes into 30 or plus years old with that. If you treat them, they may live a little longer. That's my opinion. But anyhow, some conditions definitely are more fatal. But it's important to find out what you're really dealing with as best as you can. In the terms of patient preferences, that entails choices and values. This is what the patient would want for themselves. In this case, we have 2 patients. You have the mom and you have the baby. We're acknowledging that the baby is a patient. And the values, what do the parents value about parenting this child? They might say, I don't want to be a parent of such and such, but they are already the parent. So, and the quality of life, they need to think about. And this can be scary, but they'll think about what might the life be like with the baby and for the parents as well as the child. These are realities they do have to face. You want the truth. We don't want to, quote, sugarcoat it, but we want them to have the reality and make an informed decision. Their values, of course, will play a role into that. Supports, medical treatments, medical therapies, finances, legal provisions. They want them to see what kind of supports are out there that they can garner to help them during the pregnancy, and then maybe the child, as the child grows up, there's some supports they might be able to have. A few other questions that might be considered is, even if little is known about the condition, why not let the child live? If it's likely fatal, they might think of reasons or discover reasons to continue being pregnant, like the chance to meet their child, or psychologically, knowing that psychologically parents do better if they choose to let their child live out the life. Even if the baby is stillborn, and this might be hard, but even if the baby is stillborn, many parents that meet their baby, they're so glad to meet their baby, and they find that the baby is more beautiful than they imagined, based on what they were hearing. So when they pause and clarify their values, evaluate the facts, they're in a better position to make a decision with a clear conscience. And research has shown that people who make the decision, women who make the decision, if they have some ambivalence, it worsens their prognosis after pregnancy. after the abortion. I saw that Mother Teresa, I guess you call her Saint Teresa of Calcutta now, is quoted as saying that abortion kills twice. It kills the baby, and it kills the conscience of the mother. So the parents need to pause, get answers from the medical team, other friends and relatives, the internet, maybe their faith. If you or they are open to the Judeo-Christian perspective, you can remind them that God loves them and the baby unconditionally. Help them meditate on Scripture. Josiah quoted Psalm 139, 13 through 18. And Psalm 139, 13 through 18, as well as Jeremiah 1:5 and Luke 1, 41, 44. That's where John leaped in the womb and Jesus was there, and they both were prenatal. Anyhow, there's several internet sites that I wanted to just review briefly, and then I'll have the parents also come up. These seem to have reliable content. They seem to be a source of comfort and hope, and they can be very helpful, especially in the urgent, time-critical decision-making period that we're talking about. One of my favorites is BeNotAfraid.net, CaringToTerm.org, and Prenatal Partners for Life. Actually, I like them all. I spoke with the mom for Caring to Term. There's some good stories on them. You just need to, I'd love you to familiarize yourself with them. And I will be giving a handout that will have the list of most of these websites on it, just so it can be a resource for you. So those first three can help with conditions where there are a variety of diagnoses that they might help with. And they help to give peer-to-peer support. You can see resources, and then you have various information. And you can communicate with them. The Stand-Up Girl and standupgirl.com and optionline.org are two that are 24/7 availability. They can go online and chat right away. And with Stand-Up Girl, you can text pregnant, capital letters, PREGNANT, to 313131. Or for Option Line, you can call 1-800-712-HELP, H-E-L-P. You'll get a live person. Pregnancy Decision Line is also is the one done by CareNet. It does have office hours, but it's also available. Any of those three can help the clients be directed to a pregnancy resource center that might be in their general area, so that they can get face-to-face support and some practical helps. The other ones are about specific conditions that can give people information about them. There's another one I didn't put up there, perinatalhospice.org. You might just jot that down if someone really has a situation where it's definitely a situation that really seems to be a fatal one, that the baby probably will not live very long. The hospice situation can help them in living out the child's life until they're done. One mom said, yeah, Gabriel will die, but before that he will live, and you can live with the child. So I'm just going to go through real quickly here. Be Not Afraid. Just so you know you're at the right site, this is what you can see on them. CaringToTerm.org. Partners for Life is another one that's a good resource. Some of these have doctors that are also on their boards or a part of the organization. Perinatal Hospice, I mentioned. One parent, this is talking about continuing the pregnancy for as long as the baby would live. This one, the first one, is a mom that said, she's got a chance to hold him, to see him, to love him before letting him go. And for a chance for their children to see him and also see that they would love them even if they were imperfect. The other one is a father who put it realistically. It said, I wouldn't ask to repeat this. A life's worth of pain, loss, love, and joy compressed into a few brief moments. But he said, thank you, Lily, to the child, for giving me such a clear and deep awareness of an innate fitness for loving. Trisomy 18, a lot of good information on there. It's for 18, 13, and a variety of other related trisomies. That one was started by a pediatrician, medical geneticist, and a mom who had a trisomy 18 child. This one, National Down Syndrome Society. The Down Syndrome Network of Oregon helps kids after they're born, helps the family after they're born. They'll come to the hospital and give a nice package to the parent and kind of be a support going on further on. And that's local here. That was formed by two moms who had Down syndrome. See, when parents have the kids with this, a lot of good stuff actually comes out of it. A lot of us doctors depend on what parents have developed already. Spina Bifida Association has a page for expectant parents that can give them information. So the other tool that I've pretty much hinted at is people. Of course, there are people behind the websites, etc. But some of these people can be others that are physically in your community that can help the family gain a perspective and a vision for hope. It can be parent groups, parent support groups. Those used to be physical groups meeting, but more and more they're virtual, and it's private access to these. Medical specialists familiar with the condition can be a helpful resource. And persons themselves who have the diagnosis can also be a resource. Pro-life medical personnel, and they don't have to be OB-GYNs, but they can be a variety of specialists. They can help to interpret information or at least help you advocate for you in the health arena. So although our focus is on the grieving and the decision-making time, it would take another talk to actually talk about supporting the parents afterwards, but I think learning of some of what that is like can be very helpful in your advocacy. So to give hope beyond the birth. So I'd like to introduce two people. They are two parents. They both got an adverse prenatal diagnosis, and both have raised their special needs child. One of them is not a child anymore. We have Ruthanna. But in any case, Joan Bedleon and Cindy Miller, can you come on up? I don't know who wants to go first. Okay.
32 years ago, I gave birth to my third child at the age of 28. My prenatal care was different this time than the other two children, and I didn't have an OB/GYN. I was recommended to a nurse practitioner at the same office. During the first trimester, I had 2 bladder infections and a really bad flu. I was treated with antibiotics for the bladder infections, but took nothing for the flu. They didn't recommend that. So during my 16-week checkup, my practitioner recommended that I have an amniocentesis because of the complications that I had had during that early pregnancy. She explained the situation to me of what the amniocentesis would entail and asked if I wanted to do that or schedule an appointment for that. And I told her after about a minute of thinking about it on the spot that I was not interested in that because it didn't really matter what the amniocentesis would show. My decision to keep the baby would be the same, and I would raise it and care for it and love it just like I did my other 2 children. She was a little bit shocked at that. She says that's not a normal reaction that she would expect, and tried to talk me into getting it because it would be good for me to know ahead of time if there was something, even if I did decide to keep it. And I just told her, I says, I don't need it. And again, just reassured her, and she says, okay, that's your decision. So I smiled and reassured her that, again, this child would be loved and given every opportunity to experience life, regardless of the outcome of the test. That experience provided a bonding effect on me. That's the first time that I felt Mom Bear come out. And I just says thank you. I've been asked by some people if I would have made a different decision regarding the amniocentesis, knowing now that he did have a developmental disability. Despite the fact that Chad's disability affects many areas of his life, he is living a fairly normal life and independent as well. He works about 25 hours a week at a car dealership in Gresham. He takes public transportation. He can navigate the Portland airport independently. We drop him off at the curb, and he knows how to get to his gate and check in. He has friends. He enjoys his life. And he's lived independently on his own for 3 years, and he's now currently living with us because we moved to a different city. The difference in Chad's positive outcome was that we had higher expectations of him than many parents do of their disabled children, at least those who I've been around. Rather than do everything for them at all stages of their life, we expected Chad to learn and do normal household chores from an early age. We encouraged social and community activities. Inclusion was also very important as he was in school. We provided many opportunities for him to experience life, the good and the bad, so he could understand choices and consequences. We encouraged the limits of trying new things to gain more experiences. He usually liked them, which helped him become more independent. In closing, don't give up on your kids. They will likely surprise you with what they can do. In fact, focus on what they can do, their abilities rather than their disabilities. Raise your expectations so they won't have to hit their head on the ceiling. Rely on family, church, community, close friends, and most of all, God. It's beneficial to everyone to know people care about you and what you're going through as a parent. Thank you.
Okay, my name is Joni. Anyways, I have my beautiful daughter here, Ruth Anna. So 20 years ago, I actually found out I had 3 children prior, so I had the test done between 16 and 18 weeks where they do the blood test, and they said, hey, it came back abnormal. We need to have you come back in. I'm like, okay. So it was like a whirlwind. Once they recognized that there was an abnormality with the blood tests, they went from, okay, we're going to do an ultrasound, and then I'm hearing all these signs like, oh, the banana sign, the lemon sign, and I'm like, oh my goodness, what's going on? They sent us to a doctor because we're like, we want more explanation. We want more understanding what's going on here. And all he did, I was already a nurse at the time, and he sat there and just basically said, you know, you're going to have to take care of basically a vegetable. You're going to have to take care, you're going to have to, you know, bathe her and take care of her, you know, incontinence, and she's going to be in a wheelchair. And I left there, and my husband, like, you got to be kidding me. He basically opened up a textbook and just read whatever and then added his own personal preference. And I was just, both of us were just devastated. We're just like, really? So this is your option? And then hurry up. You got till 22 weeks to have that abortion. So move it right along. And I'm just like, oh my goodness. Our beliefs at the time was that was not the option. The option was we were going to still carry on and have the child. Once we made that clear to the health community, we finally went forth. And we did multiple ultrasounds, and they kept a check on everything to make sure everything was good. That actually helped me process, for me, to go, okay, I can have a plan. And we ended up at OHSU with a doctor that specialized in this, and he was able to do the surgery and everything. But I'll tell you, in the process of recognizing that, okay, I'm going to have a child that's going to have a disability, I remember rubbing my stomach and going, wow, come on, baby, kick. Come on, make this change. Why me? This isn't happening to me. I have 3 other children that are fine. What did I do wrong? I was reading all this stuff, and I was in a hot tub at the time, and maybe I caused the issue. All these thought processes were going through my head. So even though my belief system was you don't abort your child, you're still struggling with all these internal emotions. And I think the best thing that helped me was really recognizing they gave me an option, you know, do you want a support group? What do you want? How can we help you? And actually, I spoke to a woman that basically had a child with a disability who said to me, you know what, look at it this way. Your kids are going to have issues and problems, you're going to go to the doctors more. And for me, that was really helpful to process through that. You know, you're right. My kids had issues. They all did. I have 4 of them. They all had their struggles and stuff that they've gone through and their joys. And we've just, gone to the doctors a little bit more. But she asked me I'll focus just focusing on that perspective. I don't want to is that I'm glad I made that choice to move forward. But it is hard because you have hard stop points all along the way to tell you, get rid of the kid, get rid of the kid, get rid of the child. You don't want this. You don't want to have to deal with this. You don't have to deal with this. We have options for you. Unfortunately, you know, so I'll leave it at that. But I would promote life, because it's been a joy. My daughter is 20 years old now, and we've had our ups and downs, but a pure joy. So.
I'm going to ask them to come up now. We'll open it up for some questions and of any of the three of us. Yes. Yeah, go ahead.
I also had the same situation. I had a trisomy 18 baby, and I did go through an amniocentesis, and sometimes I wish I never did. but the choice for me was never to end the baby's life, but doctors all the time saying, she's not going to live. She's not going to live, and you're going to have, why deal with the grief, knowing she's going to die? And I go, but it's not my decision to end her life now. It's my faith and my community that helped me to see that, and my husband, and we all knew it's not our decisions to end someone's life. We want her to give her the life that she is meant to have, and we did. And I was able to have her alive. She went for gestation age of about 37 weeks, but I was measuring at 42 weeks, maybe more. I did put a risk in my life too as well. There were some other complications was going on, but I was happy. I was able to make that sacrifice. She was able to live 77 minutes after birth, and we were able to hold our baby, and we named her Hannah. And on the kids, she was my 5th baby girl, and then I was able to have another baby girl after that, but she was mine.
Cool. Thank you. Thank you. Just who do we have here? Do we have some other moms who've raised? You did too? Anybody else? I just have something I need to share. Here you go.
It was such a sweet story. This mother that's shared with me her struggle with the Downs baby that she had. She did not know. She found out at birth, and the struggle with her husband and her family and all that. But what the sweetest thing I wanted to share with you is that her 2 kids, the 12-year-old came up to her one day and she said, "Oh, Mom, when I marry and have a baby, I want a Downs baby." So sweet.
Yeah. Thank you for sharing that. Anybody have any other, anything else that you think that would help the parent? Maybe something I didn't cover here. Anything? Sure. Go ahead.
I just want to add one thing. It doesn't just affects everybody within the family. I think my husband had a really hard time because he was raised a little more faith-based than I was. And he was, faith like a mustard seed. God can heal that baby inside the womb. And it didn't happen that way. And that was just a process. And just just recognizing and processing through those feelings are so imperative because it's important. But that's all I would mention.
Good. I think we have just a few minutes. Did you? Yeah. Okay, I think you wanted to say something, and then I think we'll wrap up. Hi.
Yes, I have a 39-year-old son who's autistic, and back then there wasn't a lot of prenatal testing, and that's not anything that showed up. And as was typical of that time, he was not diagnosed till he was 13 or 14. But at the time I was pregnant with him, I was recovering from a very serious eating disorder and did not want to be pregnant and thought very seriously about an abortion. And you hear these people, and then I had this wonderful child and everything's fine and they're a PhD. Well, this son is not. And the one thing I will say is that he touched lives. There was one summer he was put in with a whole group of behaviorally disturbed. We used to call them juvenile delinquents, but these are all kids that, and it was racial, it was gang related, and these kids were constantly fighting with each other. But by the end of the first week of class, the head boy of each faction took a liking to my son, and And by the end of the second week, the one group was Hispanic and the other group was Anglos. So they knew he liked Dr. Seuss. So we're getting Dr. Seuss books coming home in Spanish. And by the end of like the third week, all these kids are working together. And these were, in their very young, very jaded lives, because these were junior high kids. They met someone who was totally innocent, who didn't understand. And, for all the sacrifices we made, and that was one of the stories, but many, many times he changed lives because he could reach the unreachable.
Right. That sure brings, thank you so much for sharing that. That brings out that point that, yes, there's a reason for everybody conceived. We don't always know the reason, and we don't always see it right away. And there are people that they impact that we wouldn't impact. There was somebody else. Yeah.
I'll just say quickly, our second oldest of 7 was born, and it was determined that he was given failure to thrive syndrome. And he just, to make a long story short, he didn't develop past a 6-month-old child. And he was blind, he had seizures, but he had to be tube fed, and we had physical therapy to give him to keep his limbs stretched out. And he lived till he was 18. And all I would say to other parents, and with my third pregnancy, my doctor asked if we wanted an amniocentesis, and we said no. But what it did do is the effect on his siblings, because everybody had to help tube feed, because I was busy and we lived on a farm. So by the time my kids were in first grade, they knew how to tube feed their brother. And they all had to help with this physical therapy. And to them, that was fun. Yes. So I now have 2 nurses, a social worker, 2 teachers, and a biologist. and they care about people.
That's exactly it. Thank you. I'm gonna just go ahead and wrap up here. So let's remember, life is continuous from conception on. Not testing is an option. Expectant parents receiving this need hope and information. There's a very vulnerable human being that's at risk in these situations. Your voice may be the only voice that some of these women hear to choose life as the only alternative. And if they may not want to be a parent of a child with an issue, they already really are, and so we can help them that they can start accepting that child and live with that child from then on. Even if the diagnosis is correct, it doesn't tell the definitive prognosis. So the children can do a lot better than we expect. And sure, there are challenges. We're not denying that, and we've heard that. But the impact of that child is can be very important. I trust that all of you now better understand the plight, and obviously some of you have lived through it. You've been exposed to the resources, and I hope you'll familiarize yourself with that. I'm going to pass out before you leave, make sure to get a handout that talks of the resources, a couple quotes from us. It's right on the table right here. And then I hope that you can boldly assure expectant parents that there really is hope. For surprise, surprise, life is the better choice, and the tests don't tell the definitive diagnosis. By the way, we did do a mule ride. Not a severe one, but with a guide and with a guide and a group, we were able to do it. And that's how people can do that in their lives also. Thank you.